Hello guys, this is Vamshi Krishna. So in this video we are going to see some of the basic questions. So the first question is, the nurse seen a client with a prominent forehead and a prominent jaw gaps between their teeth, thickening of their facial features, large hands and feet, with thick fingers and toes. As a nurse, she identified the condition of that client. So the options are dwarfism, gigantism, Down syndrome, none of the above. So the right one is option B, gigantism. So the gigantism is a condition when the pituitary gland is secreting the growth hormone, increasing of secretion of growth hormone. So due to that, the gigantism, the condition may develop in the person. So the right answer is option B. So the gigantism is a person will be looking like in this picture. So here you can see the picture of the person with the gigantism condition. So the next question is, a client has a problem of ovaries are not making enough eggs. She asked to the nurse what is the condition and explained. So the client, she has the problem in the immature eggs in the ovary. So she needs some explanation from the staff nurse. So the as a nurse, she said dash hormone deficiency, the eggs are not mature. The options are follicle stimulating hormone, ADH, antidiuretic hormone, ACTH, and oxytocin. So the right one is option A, follicle stimulating hormone. So due to the deficiency of FSH, so it can lead to the immaturity of the eggs in ovary. The next one is, when a patient had done is blood examination of thyroid function test. The test results are given like thyroid stimulating hormone 12.3 milliequivalents per liter due to. So what is the reason that having the person is having thyroid stimulating hormone 12.3? The options are defect in thalamus, defect in posterior pituitary, defect in thyroid gland, defect in anterior pituitary gland. The right one is option C. There is a defect in thyroid gland. Why? Because the TSH is secreted from the anterior pituitary. So normally anterior pituitary is secrete the thyroid stimulating hormone. So when there is a problem in the thyroid gland, that is the thyroid gland is not secrete the enough thyroid hormone, T3 or T4. So what will happen here, when the thyroid gland is not secreting the thyroid hormone, the pituitary gland, it is continuously secrete the thyroid stimulating hormone to produce the thyroid hormone, okay, thyroxine. So for example, the best example is the teacher and the student. So when the student is not reading well, the teacher is focusing on the student more, okay. So this is the teacher is the pituitary gland, student is the thyroid gland. So when the student is not reading well, the teacher is focusing on that student too much. The same condition, it is thyroid stimulating hormone is produced from the anterior pituitary. When the thyroid gland is secrete the a sufficient thyroxine hormone, means it will be normal. So when the thyroid gland is not producing the sufficient thyroxine hormone, the continuously pituitary gland will secrete the thyroid stimulating hormone. So the right answer is option C. There is a defect in the thyroid gland. Then only the thyroid stimulating hormone will be higher in the patient. The next one is, A client admitted with a head injury, and the nurse identified that the client urinary retention catheter drained large amount of clear and colorless urine. Then what is the nurse identify most likely to cause? Okay, so the patient had the head injury. So main points you have to underline: head injury and a large amount of clear colorless urine. So what may be the condition? The options are: increased serum glucose level, deficient of renal perfusion, inadequate ADH secretion, increased amount of IV fluids. So what may be the condition of this patient? So the patient has the head injury. So what will happen in the case of head injury? So there may be the damage in the pituitary gland. Okay, so the pituitary gland also may be damaged. So what will happen here? The character is the large amount of urine. Okay, large amount of the urine. So what will happen here? When there is a inadequate ADH secretion, what will happen? The kidneys are producing more amount of urine. Okay, so this is the right answer. Option C is the right answer. Inadequate ADH secretion, it can leads to the color large amount of urine. So in the case of head injury, there is a risk for the pituitary gland damage. The next question is: this hormone increases when she is in love. Okay, this is lovely question. Answer everyone. When she is in love, giving someone a massage or cuddling, giving someone hug. So when a woman, she has got some lovely feeling, so which hormone will be increases? Options are: prolactin, estrogen, progesterone, oxytocin. The right one is option D, oxytocin. Okay, so in the woman, when she's in good mood and in love, the oxytocin hormone is increased. Okay, so it is also called lovely hormone. The next question is, it is really big question. A mother asked to the newly working nurse, okay, newly working staff nurse, she don't have any experience and she has no clinical experience about the mechanism of breast milk production. Okay, the nurse said, when your baby suckles, it sends to the it sends a message to your brain. The brain then signals the hormones prolactin and oxytocin to be released. Prolactin causes the alveoli to begin milk making a milk. Oxytocin causes muscles around the alveoli to squeeze the milk out throughout the milk ducts. So I hope you all understand the question. So a small explanation: a mother, she asked a new nurse about the mechanism of breast milk production. A mother, she asked about, she want to know a mechanism of breast milk production. So nurse said that when the baby suckles, it's sent to the brain, and the brain signals hormones which are prolactin and oxytocin to be released. So what will happen? Prolactin will work on the making a milk, and oxytocin will work on the squeezing of milk out. So is it right or wrong? It is true or false? The right one is option A. It is true. So the next question is, underproduction of thyroxine leads to. So when the thyroid gland is not secrete the a sufficient hormone, that is thyroxine, what will happen? Options are myxedema, Graves disease, Cushing disease, acromegaly. The right one is myxedema. Okay, so this is a feature of when the person is having underproduction of thyroxine. The next one is, conversion of glucose into glycogen is known as? Options are glycogenolysis, glycogenesis, gluconeogenesis, glycolysis. The right one is option B, glycogenesis. The conversion of glucose from the glycogen, it is known as glycogenesis. The next one is which of the following cell of pancreatic islets secrete hormone glucagon? Options are delta cells, beta cells, alpha cells, all of the above. The right one is alpha cells. So the alpha cells secrete the glucagon. So the delta cells are producing somatostatin hormone, and beta cells are producing insulin hormone. So the delta cells are the somatostatin, beta cells are the insulin, alpha cells are the glucagon. Option C is the right one. The next question is renin, angiotensin, aldosterone released to. Options are, so what is the function of renin, angiotensin, aldosterone? Options are maintaining sodium level, maintain BP, maintain blood volume, all of the above. So the right one is maintain BP, blood pressure. So this is the function of renin, angiotensin, aldosterone. The next one is which of the following feature is not related to Cushing trait? This is Cushing trait. Options are increased BP, hypothermia, bradycardia, widening of pulse. So the right one is hypothermia. So hypothermia is not related to the Cushing trait. So in the case of Cushing trait, the person will have increased blood pressure, bradycardia, and widening of pulse. The next one is a client is receiving injection prednisolone as continuous IV infusion. So what is the important nursing management? Options are urine specific gravity, blood sugar monitoring, check abdominal girth, head circumference. So for which one the nurse she has to focus on? The right one is option B. So that is blood sugar monitoring. So the patient is on the prednisolone injection. So it is working on the blood sugar increasing. I mean increasing of blood sugar in the blood. The prednisolone and other steroids can cause spike of blood sugar. Okay, spike is nothing but increase by making liver resistant to the insulin. So when the patient is having the steroids therapy, the insulin resistance may be happen in the liver. So what will happen? There is a risk for increasing of glucose. The next one is moon phase with central obesity is noticed in. Options are Addison's disease, Cushing syndrome, Down syndrome, Turner syndrome. The right one is Cushing syndrome. So in the case of Cushing syndrome, the person will have the moon face and a central obesity. The whole body will be obese. The next one is which of the following is a neurotransmitter? Options are dopamine, norepinephrine, acetylcholine, all of the above. The right one is all of the above. So these three are the neurotransmitters. So there are some of the neurotransmitters we will see. Glutamate, GABA. GABA is nothing but gamma aminobutyric acid. Dopamine, adrenaline, serotonin, oxytocin, and acetylcholine. So these are the some neurotransmitters. The next question is a client with a midline facial defect, single central incisures, micropenis, hypoglycemia. So the condition of this client is deficiency of which of these hormones. So among this, which hormone it can leads to this kind of features we can see in the client. The options are mineralocorticoids, growth hormone, somatostatin, insulin. The right one is growth hormone. So when there is a disturbance in the growth hormone, we can see this kind of clinical features in the client. So we will see some of the hormonal deficiency disorders. So first one is the gigantism or acromegaly. So symptoms of acromegaly or gigantism include enlarged face and hands. Okay, big hand and face. Changes to the face may cause brow bone and a lower jawbone protruded. Okay, protrusion is nothing but coming out. And nose and lips to get larger. Big nose and big lips. Acromegaly is a hormonal disorder that develops when your pituitary gland produce too much growth hormone. So increasing of growth hormone, it leads to the gigantism. Okay, so this condition is due to the defect in the pituitary gland, that is due to the excessive production of growth hormone. So the next disease is the Addison's disease. So it is caused by damage to the adrenal gland. Damage to these glands results in too little, very small amount of hormone cortisol. Okay, often this hormone is known as aldosterone. So due to the hyposecretion of cortisol, it leads to the Addison's disease. So Addison's disease symptoms are brown and pigmentation on the skin, hypoglycemia, postural hypotension, and changes and disturbance in the body hair, GI disturbances, weakness, and weight loss. So these are the clinical features we can see in the case of Addison's disease. So when there is an increasing of cortisol leads to the Cushing syndrome. Okay, so when there is decrease in cortisol, it leads to the Addison disease. When there is increasing, it leads to the Cushing syndrome. The last one is a Graves disease. So it is an autoimmune disorder that can cause hyperthyroidism. Okay, increasing of thyroxine levels in the blood. So overactive thyroid, overproduction of thyroid gland, it leads to the Graves disease. So this is end of my class, guys. Thank you for watching.